So it's just after 10, and I'm going to go ahead and get started. Good morning again, everyone. I'm Michelle Watson, and welcome to the keynote session of the 2026 NAMI New Hampshire Annual Conference, Moving Forward, Hope in Action. We're thrilled to have Hannah Wesolowski, Chief Advocacy Officer at NAMI National, with us today. This keynote presentation is in Zoom webinar, and there will not be an option to turn on your camera or microphones. We will welcome questions in the Q&A and do our best to get to most of them. Now I'd like to introduce Susan Stearns, NAMI New Hampshire's Executive Director, and she will introduce Hannah.
Thanks, Michelle. Good morning again, everyone. It is truly my pleasure to introduce this morning my friend and colleague, Hannah Wesolowski, Chief Advocacy Officer for NAMI National. Hannah leads NAMI National's Government Relations Policy and Advocacy Team, fondly called GRPA, which develops NAMI's policy positions, advances NAMI's federal policy priorities, and supports the policy work of the NAMI Alliance at the state and local level. She has been a national leader on topics like building a mental health crisis continuum of care since the launch of the 988 Suicide and Crisis Lifeline in 2022. She serves as a member of NAMI's executive team and is a frequent spokesperson to the media on a variety of topics related to mental health and suicide. She serves on the executive committee of Friends of the National Institutes of Mental Health and on the board of directors of the Public Affairs Council and the American Brain Coalition. Hannah has been with NAMI since 2017. Prior to that, she worked for the Public Affairs Council, American Speech Language Hearing Association, American Institutes of Architects, and New York University. She earned a Bachelor's of Arts and a Master's of Public Administration from New York University. And perhaps something that makes her near and dear to our hearts, she is originally a New Hampshire native. So welcome, Hannah. And I want to take a moment to thank you. There have been times in the past year when we have had some abrupt uncertainties thrust upon us, and you and your team have been incredibly responsive and incredible leaders, and we are a stronger alliance for it. So thank you.
Oh, thank you, Susan. And you all in New Hampshire have an amazing leader in Susan Stearns and the wonderful staff at NAMI New Hampshire. So it is always an honor to work with you all. And as Susan said, I'm from New Hampshire, was born and raised in Manchester. So NAMI New Hampshire is very near and dear to my heart. So I am happy to be here. I'm going to try to share hope. A lot of the news I have to share is pretty heavy. So I apologize for that first, but I will try to end with hope and infuse hope throughout. And I really do welcome anyone's questions throughout the presentation, and I'm going to try to save some space at the end for questions as well. So I'm going to go ahead and share my screen. Hopefully those slides are coming up.
They are. You're
wonderful. Good. Hooray, it works. All right, well, let's get into it. As Susan said, I lead our government relations team at NAMI National. So I primarily work on the federal side and collaborate closely with folks like Susan and your amazing staff at NAMI New Hampshire in supporting state policy work as well. First things first, one of the most important things I want to share is that NAMI is nonpartisan. Our advocacy isn't based on politics or political party. We're guided by our North Star, which is always, will this policy help or hurt people with mental illness? And we decide how to act based on the answer to that question. So as we talk about the different policies today that are happening at the federal level and impacting New Hampshire, that's the lens that we're looking at it through. We don't care what, if you identify as a Republican, Democrat, Independent, that doesn't matter because mental illness impacts all of us. It's really about whether policies help or hurt people with mental illness. So let's just start with the current political environment. As we enter 2026, it's an interesting year. It's going to be a critical year to implementing the Medicaid changes from the One Big Beautiful Bill Act, or OBA, as many people in DC call it. And you heard a bit about that in the opening session this morning about how those changes are coming to New Hampshire, and I'm going to get into that a little bit more. At the federal level, there is a very, very, very tight margin in the House of Representatives. It's a one vote margin. So there is not a lot of space for additional policies that'll be divisive. That margin has gotten smaller over this Congress. And even just yesterday, there was a member of the Republican majority who changed their party affiliation to independent. So it's constantly changing. And this year is an election year in DC. And while NAMI does not engage in elections, that does close the window for additional policy action in Congress this year because so much of the energy after early summer will be spent back in states campaigning, to be quite frank. At the end of last year, Affordable Care Act tax credits to help people afford health insurance on the marketplace expired. We're going to talk a little bit about that. And then there's also this ongoing tension about the size, the scope, and spending in the federal government. And that's had some real implications for the mental health space and what's available and what we've had to fight to maintain across the country. There's also been an increase in discriminatory policies, and a lot of those have been focused on people with mental illness, people who are unhoused. And just last week, House Republicans, who are the majority, said that they are looking at another reconciliation bill. That's a wonky term, but basically the One Big Beautiful Bill Act was a reconciliation bill, has to do with spending and revenue. And so, well, we'll see if there's political appetite in DC for another one, but bottom line is if there's a bill that has a lot of policies in it, they'll have to find ways to pay for that, which could mean additional cuts in programs we care about. So these are all the things that are percolating as we look to the political environment in 2026. And that comes on top of all the things that happened in 2025. When I say it's unprecedented times, I really mean it's unprecedented times. There were a record number of executive orders. We saw grants that were eliminated, anti-DEI actions, cuts to Medicaid, to SNAP. A lot of federal staff lost their jobs, attempts at federal government reorganization, threats to science, economic uncertainty, and certainly a lot of these things are carrying over into 2026. So let's talk about some of the implications, what's happening this year and what to be on the lookout for. First, I'm going to spend probably the most time talking about Medicaid cuts and OBA, the One Big Beautiful Bill Act. Just for a quick recap of this was signed on July 4th last year. It's a comprehensive legislative package. It impacts all aspects of the federal government in some respects. But a big part of it was Medicaid. This is likely going to be the president's signature domestic policy accomplishment. Usually in the first term, that first big package is the biggest thing. And because of those tight party differences in the House and to some extent in the Senate, it's going to be really hard to do something at this scale moving forward. Just by the numbers, the bill represents roughly $1 trillion in cuts to Medicaid over the next 10 years. It's trillion with a T. The Congressional Budget Office, which is the nonpartisan arm of Congress that looks at the implications of legislation, estimates that 10 to 15 million people will become uninsured over the next decade as a result of the changes in the bill. The bill doesn't just cut Medicaid, it also cuts SNAP, the Supplemental Nutrition Assistance Program, also known as food stamps. So there's significant changes coming there. Despite a lot of these cuts, because of the tax cuts that are in the bill will actually increase the federal deficit by 3.4 trillion over the next decade. So it's a complicated bill. This is only a tiny part of what's in it. There's a lot about energy. There's so many different aspects of this bill. But these are just some high level numbers so you understand just the scope and magnitude of this enormous legislation. So you've heard a lot about Medicaid. You heard about it this morning from the governor and the commissioner and Susan. There are cuts coming. There are changes coming. But at least from the federal perspective, most of those changes are not yet in effect. And in fact, I'll show you a roadmap for the state of New Hampshire later. You'll see that things are coming in phases. But our job isn't done. We advocated strongly against this bill and against cuts to Medicaid, but there are a lot of details that are still unknown. And how this is going to be implemented is going to vary state to state. And as you heard, New Hampshire also took some action around Medicaid prior to the federal bill. And so that's going to add some complicating considerations for the state of New Hampshire as well. I will say that NAMI advocates made a huge difference. Over 170,000 actions by NAMI advocates just on Medicaid last year alone. Every member of Congress heard from NAMI advocates at least a dozen times about Medicaid cuts. And while it may feel like we lost, at the beginning of the year, there were talks about dismantling Medicaid as it currently stands in a significant way. Block grants for Medicaid, per capita caps, ending Medicaid expansion. Those things did not happen. We certainly aren't happy about where we ended up, but it could have been even worse. And the fact that we would still have a Medicaid program to fight for was not a given a year ago. So, I really want people to know that their advocacy made a difference. And we still have opportunities for advocacy to continue to fight for our community. So these are some of the big changes that are happening. So people who are covered by Medicaid will have to verify their eligibility at least every 6 months. Previously, it was a year. So once a year, you had to verify that you were eligible. So starting next year, it's going to happen twice a year. What does that mean? Well, that means that people who maybe moved and didn't update their address might not see the paperwork that they have to go online and verify something. Anytime there's additional paperwork, there's an opportunity for people to fall through the cracks. And that's what we're worried about. That people it's not that they're not eligible, it's that they may miss the steps to verify their eligibility. So it's going to be really important for all of us to share what we know with our friends and family and neighbors to make sure everyone is updating that information. Now, the federal Medicaid program also added cost sharing in Medicaid for the first time. This would be up to $35 per service or per visit. Mental health and substance use disorders were exempted from that. I will note that New Hampshire also has some cost sharing elements that they've been looking at, but this is on the federal level on kind of a national scale. Previously, if you got care and then signed up for Medicaid, you could have coverage for 3 months prior to the date of enrollment. They're closing that period to 1 to 2 months for everyone on Medicaid. It'll be 1 month if you're covered by Medicaid expansion. It'll be 2 months if you're covered by traditional Medicaid. And then the big thing that I'll focus on is community engagement or work requirements in Medicaid, which go into effect next year and are one of those areas that's further complicated by the fact that New Hampshire also passed work requirement legislation last year. And so a lot of things to sort out at the state level. So just some numbers about Medicaid in New Hampshire. As of January 31st, 173,000 people in New Hampshire were covered by Medicaid. That includes 52,000 people on Medicaid expansion or granted advantage. Estimates are that up to 20,000 or so people could lose their coverage because of some of these changes under granted advantage. So most of these changes only apply to individuals who are covered under Medicaid expansion. And as Susan talked about earlier, it's really hard to know which program you're covered by. So we have a lot of education to do. That's something we recognize here at NAMI, that we have a lot of work to do to help people understand what program they're on and whether they might fall under some of these changes. It's really complicated. Not only do you have multiple programs in New Hampshire, every state has multiple programs that all fall under Medicaid. So it's really hard to understand what you're covered by and what will apply to you. So be on the lookout for more as the year goes on. We certainly are ramping up our education resources. And the changes in the One Big Beautiful Bill Act will have a huge impact on New Hampshire because New Hampshire could lose around $200 million each year in Medicaid funding because of these changes. The way that Medicaid is financed, there's some new limitations, and there's just fewer benefits that New Hampshire will be able to take care of. So estimates are $2 billion over 10 years. That's a lot of money for the state. that means the state's going to feel the pinch and have to make decisions about what services to cover, what cuts to make, and we're really concerned about what that's going to mean in New Hampshire and across the country for mental health services. So community engagement or work requirements. A lot of text here, I apologize. What I want you to walk away with knowing is that most people on Medicaid are already working or qualify for an exemption. So this is a snapshot of the whole country. 64% of people who are required to meet these work requirements are already working full-time or part-time. Others are in school. They're not working because they're a caregiver. They're volunteering. There's only a really small piece of the pie that is not working. And the reasons are often they're retired, they're unable to find work, or there's another reason. So those are important considerations. And in New Hampshire, I think estimates are at 67% of individuals who will be subject to these community engagement and work requirements are already working. And the others may be in school, maybe caregivers. So as the governor noted earlier, there are some exemptions, and the commissioner talked about carve-outs. So first up, only people between 19 and 64 will be subject to these work requirements. And again, only people who are under granted advantage. And there are additional carve-outs here if you're a caregiver for somebody 13 or under, or somebody who is disabled, or a veteran with a total disability, a pregnant or postpartum woman. And the requirement is that a person who qualifies has to work 80 hours per month. So that's work, education, volunteering, or a combination thereof. So those are the things that are required by the federal law. Now, New Hampshire's been here before. Some of you might remember there was a 2018 law that went into effect in 2019, and it was not implemented for very long. New Hampshire's work requirement back then required 100 hours per month. And just in the first 2 months, 17,000 of the 25,000 people who had to report their work requirements did not report correctly. So 67% of the people who were impacted would have been disenrolled from Medicaid had the then Governor Sununu, continued with implementation. This is there's so much paperwork and an administrative burden, both for the individual and the state. We've seen this experience elsewhere. We've seen it in Arkansas, and that's why previous attempts at work requirements have largely failed, because a lot of people who are working or who are eligible for an exemption fall into this bucket of being disenrolled simply because they didn't click the right box or submit the right information, or get everything in on time. So, as New Hampshire looks at implementation for this, the federal work reporting requirements would go into effect in January. Again, it's 80 hours a month. There are estimates that 17,000 to 29,000 people in New Hampshire will lose coverage as a result of this by 2034. Obviously, anyone losing coverage who should not lose coverage is a horrible outcome and something that we're trying to avoid by working at both the national level, and as you saw earlier, there's the conversation working at the state level to try to inform implementation so that people with mental illness are protected. Now, there are other carve-outs that are part of this federal bill, and NAMI put out a report last fall for policymakers at the federal and state level on how they could protect individuals with mental health conditions from losing Medicaid. That report, it's really wonky, but if you want to look at it, it's at nami.org/work requirements. You can also find it at nami.org/Medicaid, which is our resource hub. And basically, the Federal Health and Human Services has a lot of decisions to make by June of this year. That then gives states a little over 6 months to comply with the federal regulations to implement these by January. If you don't often engage in policy work, 6 months to figure out all these details is an incredibly, incredibly short period of time and incredibly difficult to do. So a lot of this, we don't know how it's going to play out. One of the carve-outs is for individuals who are medically frail. That includes somebody with a disabling mental disorder. What we don't know is how that's going to be defined because that's not a term that's already defined by federal law. We want broadest possible inclusion for that exemption. We want to make sure that people don't have to have a diagnosis. We know how hard that is, that people don't have to be accessing care currently for a mental health condition because we know how hard that is. We want the broadest applicability of that exemption so that anyone who has a mental illness, which we know your symptoms may vary over time, that you don't lose coverage that you need simply because you might be facing symptoms that don't allow you to work 1 month. They might allow you to work another month. And so we want that flexibility for individuals to allow them to continue to live their best fulfilling lives and be able to access that care because we know losing your health care doesn't help any health condition, certainly not your mental health condition. So again, a lot of these details are still to be worked out. And we don't know exactly how this will all play out. NAMI is very much at the table. We've been working with the Federal Department of Health and Human Services on this. We provided a lot of information. So there's a lot more to come. And as I said, only those individuals on that previous slide would be subject to this. And then there are further carve-outs that people might get exempted. But what we really want, not only do we want to maximize these exclusions, but we want to minimize the burden on you or your loved one. You heard about that app this morning. That's great. But we want to make sure that individuals do not have to jump through hoops to prove that they either comply with these work requirements and are working or that they're exempt. We want to make it as easy as possible on the individual so people don't lose their health care. The legislation does put a lot of burden on states to verify with any information they have that individuals are complying. So the burden isn't as much on you. However, states don't have a lot of these systems in place already. I think we saw that with the 2019 implementation in New Hampshire, and looking at this now, your state Medicaid program doesn't necessarily have all employer data or education data. We don't have a way to track volunteering. We don't have a way to easily confirm that somebody's a caregiver. And this is going to cost the state a lot to implement all this. New Hampshire estimates it'll cost $6 million to build these systems, to have as much information at their disposal to reduce that burden on the individuals. But only $200 million was allotted for the entire country. So this is a real challenge for states trying to figure out how are they going to collect as much information as possible. And while it's a good thing this is in the bill because it in theory reduces the burden on the individual to prove that they're eligible for Medicaid, there's a lot of work to be done to make sure this works in practice. Now, there are other changes in the Medicaid bill. I'm not going to go through these in detail, but basically this is going to limit how many resources the state has to pay for Medicaid services. You did hear about the Rural Health Transformation Project. New Hampshire was awarded $204 million, the most in New England. And that's going to be an important resource to make up for some of the Medicaid dollars that are going away. And the state has a pretty comprehensive plan on how they're going to use that money to fill important gaps. I won't go through this. This is on NAMI New Hampshire's Medicaid page as well as the Medicaid Matters. But this is kind of looking at both the changes from the state level and the federal level as they go through implementation. So if you're curious about when things are going to change, I encourage you to take a look at this. It provides a good level of detail. As you can see, we're still in that top row, so there's a lot more to come. Definitely a lot of complicating things happening, and I recognize that it's confusing and scary for all of us who may be impacted to understand how this is going to change things for our family. As I said, our goal is to continue our advocacy here. So NAMI is very much active in making sure implementation at the federal level gives broadest flexibility to states. And that we're giving tools to states like NAMI New Hampshire to really minimize the burden on the individual. And then, a big part of it for us is providing more education. So as we know more details, you'll know more details. Right now, we just don't know all the answers to everything, and that's a hard place to be, and I recognize that. That's because a lot of changes are still yet to be determined and how they're going to actually be rolled out to people across the country. Now, switching from Medicaid, but also to health insurance, I want to talk a little bit about the Affordable Care Act. So there were tax credits that helped a lot of people afford health insurance on the marketplace. So this is insurance that was set up by the Affordable Care Act. These are tax credits that really reduce the cost of premiums. 92% of people who were enrolled across the country, including I think about 50,000 in the state of New Hampshire, qualified for some version of these tax credits. And they expired at the end of last year. And so premiums in some places doubled or more than doubled for some individuals. And estimates are that more than 4 million people could lose their health insurance simply because they can't afford it over the next decade. Already, we've seen that 1.2 million people, fewer people enrolled in the Affordable Care Act marketplace this year. So we're already seeing the implications of that because who can afford to pay double premiums every year? This was, if you might not remember, but this was a focal point of that record-breaking government shutdown we had in October and November. These tax credits and kind of their impact on individuals. I do want to give a huge shout out to NAMI New Hampshire. Susan came to DC several times last year to advocate for Medicaid, to advocate for these tax credits. Representative Pappas actually was a co-sponsor of legislation that did pass the House but has not passed the Senate to extend these tax credits. Susan kindly came to DC in December to testify on behalf of NAMI about the importance of these tax credits and extending them. You can see maybe over on the left in pink, Senator Shaheen, and I believe Senator Hassan's also on that panel there. Susan, as expected, did an amazing job representing all of us at NAMI, talking about this issue and how it impacts people with mental illness. About 1 in 6 people who get their insurance on the marketplace get coverage for mental health services. So we know that this is an important resource for many in our community, and continue to fight for these to be extended. But right now we're kind of in that abyss where they haven't been extended and people are facing those higher costs. So going on to yet another topic, restructuring of the federal government. There have been a lot of efforts over the last year to reduce the size of the federal government, to reduce spending of the federal government, and that's had a lot of implications for us in the mental health space. Just at a high level, HHS is the Department of Health and Human Services. More than a quarter of their staff has either been let go or has voluntarily left. And the Substance Abuse and Mental Health Services Administration, SAMHSA, which is the federal agency dedicated to the programs that are most important to our community, has lost an estimated half of their staff. That was only with a 900-person staff to start with. And if you think about it, 84 million adults in this country live with a mental health and or a substance use condition, and the agency only had 900 people. It was a pretty lean agency to begin with, given the scope of mental health and substance use conditions in this country. And now we're dealing with fewer than half. And so the dedicated folks that are there are working double, triple capacity to continue grants flowing to states and doing everything that they can. But it's certainly a difficult time for them, and we thank them for their service because there's so much need out there. There was also a proposal last year to kind of get rid of SAMHSA as a standalone agency and merge it into a new administration for a healthy America. That's an important point I'll get to when I talk about where we are with federal spending. But there's also a lot of cuts on the research side. And all of us know that we certainly are far from having all of the understanding of the brain that we need, all of the treatments and medications that really do address mental illnesses appropriately. We have so much more work to do, and we're fearful that a lot of these cuts will slow down the research momentum that we had been seeing. And that's why fighting for the National Institute of Mental Health continues to be a priority for NAMI. It's the reason our national office first started advocating for research funding. And it's still a cornerstone of what we do day in and day out. There were a lot of cuts last year as well. So grants that Congress had appropriated were cut off or rescinded. Most of these are tied up in legislation. So that makes it really confusing and a lot of work for states to figure out where this money is, what they can do with it. But the top one is the one I'll focus on the most, $1 billion in COVID relief funds. So these were funds that were dedicated during COVID, but were supposed to be available through the end of last year's fiscal year, were rescinded 6 months early. So states lost a lot of money and resources that funded things like mobile crisis response and 988 and other mental health services. And we know the mental health impact of the pandemic has a long tail that didn't end when the public health emergency ended. So this was a real blow to communities across the country. And then we had January of this year. So you might have heard about this 24 hours of chaos, as we call it. We woke up on January 14th and found that almost $2 billion, about a third of federal spending on mental health and substance use programs, was abruptly cut overnight. No heads up. About 2,900 grants were impacted, including some that NAMI New Hampshire received. The mental health community stepped up, and the bipartisan support of mental health and substance use care on Capitol Hill was evident because this was reversed a day later. And frankly, no one in the administration has taken credit for making this initial call because it was pretty universally denounced across the political spectrum. And, NAMI advocates again stepped up, over 17,000 letters and calls to Capitol Hill by NAMI advocates in less than 20 hours. I think we set a new record for ourselves there. So luckily that money has been restored. But it's something that we're concerned about happening again. This is important money that funds programs in our community. So something that we're remaining vigilant on. But let's talk about some wins. So we had another very brief government shutdown at the end of January, but then Congress got their stuff together and they passed a bunch of bills that fund various programs, funds most of the government. And in that, federal funding for fiscal year 2026, which we're halfway through, we have some wins. So remember how I mentioned that the administration had proposed eliminating SAMHSA as a standalone agency? Well, that didn't happen. SAMHSA still exists as a standalone agency. Congress saw to that. They also had proposed merging the National Institute of Mental Health with several other institutes at NIH. That didn't happen. NIMH is still there as a standalone entity. The administration had proposed that a lot of mental health programs, some of those that were targeted in January, be eliminated. None of those programs were eliminated in Congress's final budget. In fact, a big win for us is that some of these programs were not only not cut, but they were funded at the same level or even increased, which was a huge, huge win because not many areas saw that. And then because this happened at the end of January, right after those January 14th cuts, Congress also put in some guardrails for future grant cancellations. So the administration now can't just send out those cancellations. They have to let people know on Capitol Hill 72 hours before. So hopefully that gives time for Congress to rally and push back should we face something like that in the future. So those are definitely some bright spots, and they're all thanks to advocates. And so if you leave with nothing else, advocacy is important and your voice matters. Now, there are a few other things happening that do impact people with mental illness. One, there was an executive order, or EO, sorry for the shorthand here, on homelessness that came out at the end of July, and it was called Ending Crime and Disorder on America's Streets. Now, there's a huge emphasis on involuntary commitment in this executive order, and that's kind of played out in other things that we've seen since then. And we've seen states expanding the use of involuntary commitment. Now, Involuntary commitment might be an option for a small number of people where other treatment options haven't worked, and all other avenues have been exhausted. And NAMI recognizes that, but also recognizes it shouldn't be our primary strategy to get people help, that we should be trying to get further upstream. This executive order really does focus on coercive tactics. And it also disavows strategies that we know have been really important, like housing first, making sure people get into housing while we address some of their other either social or health issues, and harm reduction strategies, which have been so important, especially in a state like New Hampshire that faced such an opioid crisis, to really implement those harm reduction strategies. Now, since this executive order, we've seen other policies come out that reference it. And, one of them that I think has a direct tie, and you heard about this, were some changes from the Department of Housing and Urban Development. This would have directed funds away from permanent supportive housing, which we know is incredibly effective in providing housing and services, largely to people with mental illness, to make sure that they can be stable and get the services that they need. Luckily, this was stopped, and I do have to say that your governor was a key part in abandoning this effort. She stood up to the administration. She called on the administration to walk this back. And one of the first people I heard about on this issue was Susan. I think maybe it was a Friday night, Susan, when you and I talked. Susan reached out to the governor, reached out to partners, reached out to the commissioner. So again, NAMI New Hampshire's advocacy is crucial here. And the governor really deserves some credit for standing up for this and working with the administration to roll these changes back. Just adding this quote here, it's from one of our statements, that we want to address chronic homelessness as a country, but the strategies that have been proposed here are not the answer, and there's a lot more work to do. So, in fact, I think I'm on a call later today to talk about some of these issues. It's a really hot topic at the federal level and something that NAMI will continue to fight for. It's one of the top issues our national helpline gets calls on, is housing, and we know it's an important issue for the NAMI community. Now, access to medications is also a big topic with our current HHS Secretary, Robert F. Kennedy Jr. These are a few quotes from the Secretary about mental health medications and how they've been portrayed. So we are concerned about how mental health medications, which we know are an important part of many people's journey, how they're being portrayed and how we're talking about it. And so this is something that continues to evolve. We're hearing a lot of conversation now from the Food and Drug Administration about SSRIs and pregnancy. And we just want to make sure that all actions and activities are based on the evidence rather than on fear. And so, NAMI continues to try to stand up to make sure that people have access to a range of options for their treatment, which is important because everyone's treatment journey and recovery journey is different. And then, one of the last things I'll talk about are some ongoing threats to the LGBTQ plus community. As you might know, 988, which has been really successful. More than 17 million people have contacted 988 since it launched in 2022. There was a press 3 option. So if you call 988, you could press 1 for the Veterans Crisis Line, press 2 for Spanish language services. And until last July, press 3 for the LGBTQ plus youth and young adult specialized services line. Unfortunately, last July, the administration ended that press 3 option. But NAMI has been working with the American Foundation for Suicide Prevention, the Trevor Project, and others to really push for that to be reinstated. That funding bill that reopened the government in early February did restore money for youth specialized services. So, we are continuing to work with SAMHSA on how that will be implemented. We're also working on legislation that puts into law that this option needs to be available for people. We do recognize now that it's been taken away, it's going to be really hard to regain people's trust. So even if it is reinstated, that's a really hard effort to overcome. But we will continue to advocate because we know that far too many of our young people who identify as LGBTQ plus struggle with suicidal ideation because of how they're treated in society. And we want to make sure that we have this option available so that they have a place to be seen and supported and help them get through crisis. There's also been a lot of federal efforts on limiting gender affirming care. There have been some guidance put out by the Centers for Medicare and Medicaid Services, CMS, that basically has told hospitals that they will not receive any Medicaid or Medicare funding if they provide any types of gender affirming care. And gender affirming care can range a lot of different options for individuals. People jump to kind of surgery, but that is not necessarily what gender affirming care is. It's a range of options that support an individual and their authentic identity. And so we know these arbitrary limits could cause devastating impact on the community. And then finally, there's a Supreme Court case that we're waiting to hear about. It's Chiles versus Salazar. Conversion therapy is a practice that has been shown to cause great harm to individuals. It's called conversion therapy, but use that term loosely. This Supreme Court case is trying to, a lot of states have banned conversion therapy. The Supreme Court case, it's made it all the way to the Supreme Court, is trying to overturn a ban in California. And if that happens, could have implications across the country. NAMI continues to try to stand up for our LGBTQ plus community. In January, there was National End Conversion Therapy Day. We wrote an op-ed with the Trevor Project that was in The Hill, which is a DC newspaper. And we have submitted amicus brief in this Supreme Court case as well to make sure that the mental health implications of this practice are considered as the Supreme Court looks at the case. So I think there are a lot of opportunities for hope despite my dour updates here. It seems like a lot, and I know it seems really hard to feel hopeful about the future, but mental health is if not the bipartisan priority on Capitol Hill. There is no office where we don't get a positive reception talking about mental health. There may be differences of opinion on how to get to the solution and how to pay for the solution, but there is wide agreement on Capitol Hill that this is something that affects every family and something that we need to address on a wide scale. This picture is my colleague, Michael Alinsky. He's our primary lobbyist. On Capitol Hill with bipartisan group of lawmakers relaunching the Congressional Bipartisan Mental Health Caucus. There's a lot of great bipartisan work being done on mental health, and it is really gratifying to see, like we saw in January when the $2 billion in grants were cut, members on both sides of the aisle step up on that. When Press 3 option in 988 was eliminated, members on both sides of the aisle have signed on to legislation to reinstate that. There is a lot of bipartisan support here, and that gives me a lot of hope. Also, Congress did not include the administration's proposed cuts for mental health. None of them. None of them were included in the federal spending bill. And that, again, shows me that mental health continues to be a priority. And so when we look at a lot of negative actions happening, we can still see that we have a lot of support from Congress fighting for the mental health of all of us. When we talk about Medicaid, we still have a lot of advocacy to go. So as you hear from NAMI National, as you hear from NAMI New Hampshire, we do need your voices. We need to continue to stand up so that we limit the impact of these changes on people with mental illness. And there's some good stuff happening too. Last year, we were able to successfully, after years of work, get barriers to accessing clozapine, which is a very effective treatment for treatment-resistant schizophrenia, to some of those barriers to be removed so that people who may from it can access that medication. The Support Act, which reauthorized a lot of mental health and substance use programs, passed Congress by overwhelming majorities last fall. So there's good stuff happening, even when some of this news feels really heavy. There are reasons for hope. And so I hope I can leave you on a somewhat positive note, and also leave these resources for you. If you want to sign up for our advocacy alerts, nami.org/take action. You can find all of our Medicaid resources, including fact sheets for New Hampshire at nami.org/Medicaid. And if you want to learn more about what we're doing on 988, you can go to reimaginecrisis.org. So with that, I will stop, and I am happy to take questions.
Thank you so much, Hannah. I wanted to ask you before we get into some other questions, and you touched on a little towards the end of your presentation, but it's certainly been a challenging year. What's giving you hope?
Yeah. There have been, I'll be honest, there have been times where I've questioned my chosen profession and working in government relations over the last year. It has been a tough year, but I can easily say that NAMI advocates give me hope. On days that our team feels like what we do isn't going to matter. Talking to advocates on the ground reminds us that they're staying in this fight, so we have to too. If all of you who are advocates out there, I know you aren't giving up, so I'm not giving up. And that constantly fuels me and it fuels my team. I work with a wonderful group of colleagues here at NAMI National and the government relations team. And it's those NAMI advocates who have fought for decades and continue to fight. This is what NAMI is made for. The road hasn't been easy for us, never has been easy for us in the mental illness space. And so we're made for moments like this to provide support, but also to continue fighting. And we're not going to give up.
I'm just going to respond to that and say thank you for that. I frequently think about our founder here at NAMI New Hampshire, Peggy Straw, and remind myself, what would Peggy do?
Mm-hmm.
It's usually get up and
Yep.
fight.
Yep.
So.
Yep. Absolutely. We've faced hard battles before, and we'll keep fighting.
Good. Michelle, do we have some questions?
We do have a couple, Susan. So Hannah, you're talking about our advocates here, and we know that Granite Staters come out. We put the call out. We send out our weekly public policy announcements on Friday, and they answer. They reach out to their legislators, their neighbors, but how can we help advocate at the federal level?
Yeah. So there are a few ways. So if you go to nami.org/take action, you can make sure you're signed up so you get their emails at just a base level. But stories power our advocacy. I mean, that's what we are. We're lived experience. And so we have a number of ways on different topics. You can choose the one that's most relevant to you, whether you or a loved one have ever been in a crisis. If you are on Medicaid, share your story with us. Those have been so impactful. Last year during the Medicaid fight, we were able to pull stories. We collected over 1,500 stories on Medicaid alone, and we were able to pull those. We were able to connect advocates to key congressional offices. Taking that time and trusting us with your story has a huge impact on us being able to be effective and fighting for you all. So, take some time, peruse our action center, and engage in the things that feel relevant and personal to you. And I promise we will follow up. We rely on our advocates and we rely on those stories deeply, and your voices are more important than ever.
Great, thank you. It is those stories, the power of those stories. Next question is, beyond responding to the frequent emergent issues from the administration, what are the key initiatives that NAMI is focusing on with federal policymakers?
It's a good question. It's sometimes hard to remember that we actually have a proactive agenda. We want to make things better. We're not just trying to fight to keep things where they are. Research, as I mentioned, is a top priority. How can we expand research? How can we there's a lot of new opportunities and technology and resources coming on the scene, and we want to make sure that we understand the implications of those and that people are protected, that we're able to access the benefits of things. AI is an example. There may be some benefits in our space, but we also need to protect people first. And so research is a cornerstone of all of that. And continues to be a big priority for us. That's why I'm active in the Friends of National Institute of Mental Health as part of their advisory committee. Our CEO, Dan, is on the National Institute of Mental Health Advisory Council. So actually talking about grants and priorities. So that's something that we're very actively engaged in. And for us, we're always looking for opportunities to expand and improve access to care. Parity has been a priority for us since day one. And we fought really hard and worked really hard to get improved parity regulations that mental health is treated equitably. Those were finalized in late 2024, fall of 2024. Unfortunately, there was a lawsuit against them, and this administration has chosen not to defend those new rules. They would have held insurers more accountable for having better provider networks. So when you go and look at your insurance to see where can I find a therapist, and you go down the list and none of them are taking new patients or even open for business or accept that insurance, that wouldn't happen. There were so many good things in those rules. So we're still looking for ways to improve and fight for parity. We've had some parity laws on the books that cover a lot of aspects, but seeing parity in reality hasn't really happened. And so we continue to fight for that. 988 and crisis response is something that I've worked a lot on, that we've worked a lot on at NAMI. And that's really because we want to divert people from the criminal justice system. When people are in crisis, we don't want them to get a law enforcement response. We want them to get a mental health response. And we don't want people to be in crisis to begin with. We're working upstream as well, but we want to make sure that safety net is there so that we're not treating somebody who's in crisis like a criminal. And that's been a big priority for us. So continuing to span 988, but also mobile crisis response teams as an alternative to law enforcement, making sure that we're not relying solely on emergency departments as our place to go. We know the emergency departments, we often face boarding, people staying there for days or sometimes weeks before they can get care. So looking at alternative options to stabilize people. And then finally, youth mental health. How are we preventing and intervening early? Are we providing resources to schools, to teachers, administrators? How are we supporting parents? And so making sure that we have the resources and tools available across the country to be able to address youth mental health. And that's not because we don't care about adults with mental illness. We sure do. And that's the key work of a lot of our advocacy, but we also want to change the future. We want to make sure that our kids have a better future and that we're giving them the best possible opportunity. And so a lot of our work focusing on youth mental health, which is something that Congress is really interested in. So it's a good opportunity for us as well.
That's great. Thank you. And I love the new opportunities that are coming out through NAMI National for our young adults, like NAMI Next Gen, which we'll have a session with them later this afternoon.
Yes, and that's going to be good. I hope everyone joins. That's going to be a great conversation.
Yes. And NAMI on campus in high schools, really some great opportunities. We know our youth speak up a lot. So there's a comment in the Q&A from one of our volunteers and a big advocate, and I just want to read it to you. So it says, I have an idea that I'm going to bring up during This Is My Brave. And This Is My Brave is, a big event that we've got in May. I myself have been homeless before, and my idea is to have Votech high schools build and donate tiny home parks to the homeless. They can receive experience while helping out a really serious issue in America. I don't think it would be just donations, but an investment in our community. And I love that. I just love that.
We need innovation. We need to be thinking about all of the challenges we face in different ways, and we can't rely on on the government to solve all of them. They're not going to be able to, not in the time we need them to. So I love that. We need more of that. And yes, I can't wait to hear more about that idea.
Right. I love that idea. One more question, and then I think we'll wrap up. As disability advocates are raising concerns about threats to the ADA, Americans with Disability Act, can you speak to NAMI's role in protecting ADA?
Yeah, well, we were at the table fighting to make sure that mental illness was part of ADA when it happened. Ron Homburg, who was at NAMI for years, worked on this and was a key. He's retired now, enjoying a well-deserved retirement, but he was key to that effort of making sure the ADA was inclusive of our community. And we're very active in a lot of disability coalitions to make sure that those protections are not eroded. I think it is a big concern. It's one concern, among many that we have, and it's something that we continue to be active in. I think there's a lot of good education that is happening at the federal level and in Congress to try to make sure that we're protecting the ADA and other protections for people with disabilities. But, it's something that we have to continue to talk about and prioritize. I don't have the solution of how we will protect it, but I feel cautiously optimistic that the community is being very loud and very engaged. I'm hopeful that these protections are not going anywhere, and you can rest assured that NAMI will continue to be at the table. It's a cornerstone of who we are to make sure these protections are in place. But we can't rest on our laurels. We have to continue to educate and talk about these things.
And I would love to jump in here and mention that NAMI New Hampshire's former board president, our second board president, Rona Purdy, was, I think, might have been president of the NAMI National Board at the time the ADA
I think
was
so,
passed.
yes.
And she loves to tell her story about how she convinced then Senator Chuck Douglas out of New Hampshire to change his position on the ADA and secure a sizable donation to NAMI New Hampshire after cornering him on a small plane between New Hampshire and DC. So it is something that runs near and dear to our hearts, and we feel deeply in our foundation here. So we appreciate all your efforts, and we stand ready to help.
And we have the Rona and Ken Purdy Award for Distinguished Service here at NAMI National. So Rona's definitely played a huge part, and not just NAMI New Hampshire history, but NAMI history. So I love that story. And that is exactly why I love NAMI advocates, because they will never waste an opportunity to bend an ear, and they are very persuasive. So
never underestimate the power of a NAMI mommy. So
absolutely. Absolutely.
So Hannah, I just want to thank you for taking the time this morning. It was a great presentation. You've got lots of hearts floating around on here. And we really appreciate all of your efforts at the national level to help us, with all of our efforts here as well at home.
Well, thank you. Thank you, NAMI New Hampshire. And don't be a stranger. We're here at NAMI National as a resource as well. And again, you all are very lucky that you have the amazing NAMI New Hampshire team in your state.
We do have a great team. So thank you everyone for joining this session today. Please keep an eye out at the end of the day for an email that will include a link to the evaluation for this session as well as the entire conference. We really do appreciate your feedback. And at the end, after you complete the evaluation, if you need a certificate of attendance, you'll be able to download one then. A recording of this session and all of our sessions will be available later this week on the NAMI New Hampshire website, as well as our YouTube channel. So coming up next at 11:15, we have Brittany Porter and Jeff White presenting together. We are NAMI Walks, New Hampshire, building a community of support step by step. So we will have a 15-minute break with our promotion for our advocacy efforts, and we'll see you then. And thank you again, Hannah.